A client with Addison disease is experiencing nausea, vomiting, and confusion. Which lab value would the nurse expect? Correct answer is option B, hyperkalemia. Which of the following findings is most specific for myocardial infarction on an ECG? Correct answer is option C, Q-wave development. A patient with SIADH will most likely present with. Correct answer is option B, oliguria and hyponatremia. Which fetal presentation is most associated with umbilical cord prolapse? Correct answer is option B, breech. Which is the most dangerous side effect of clozapine? Correct answer is option C, granulocytosis. In which cardiac condition is a water hammer pulse observed? Correct answer is option B, aortic regurgitation. The most important action before defibrillation is. Correct answer is option C, shout clear. Which of the following drugs is teratogenic in the first trimester of pregnancy? Correct answer is option B, isotretinoin. Which type of burn injury requires fluid resuscitation if 10% TBSA is affected? Correct answer is option B, electrical burn. What is the most specific test for HIV infection? Correct answer is option B, Western blot. Which heart sound is associated with heart failure? Correct answer is option C, S3. Which of the following conditions present with a steeple sign on neck X-ray? Correct answer is option B, crop. In eclampsia, the drug of choice to prevent seizures is. Correct answer is option C, magnesium sulfate. What is the earliest sign of increased intracranial pressure in children? Correct answer is option B, bulging fontanelle. Which is the most appropriate action when a patient develops sudden dyspnea post central line insertion? Correct answer is option C, assess for pneumothorax. A nurse finds a postpartum mother with a soft boggy uterus above the umbilicus. The first action is. Correct answer is option B, massage the uterus. Which electrolyte imbalance causes prolonged QT interval? Correct answer is option C, hypocalcemia. Which pediatric condition is characterized by a current jelly stool? Correct answer is option C, intussusception. Which maneuver is used to manage shoulder dystocia during delivery? Correct answer is option A, MC Roberts maneuver. Which infection is most commonly associated with cervical cancer? Correct answer is option C, human papillomavirus. Which cranial nerve is responsible for the sense of smell? Correct answer is option B, olfactory nerve. What is the normal value of central venous pressure? Correct answer is option C, 2 to 8 mm of mercury. Which of the following is an antidote for heparin overdose? Correct answer is option B, protamine sulfate. Kussmaul respiration is seen in. Correct answer is option B, metabolic acidosis. Which vitamin is essential for blood clotting? Correct answer is option D, vitamin K. What is the incubation period of hepatitis B? Correct answer is option B, 6 to 24 weeks. Which position is recommended during a lumbar puncture? Correct answer is option C, lateral knee chest. The hormone responsible for milk ejection is. Correct answer is option C, oxytocin. Which electrolyte imbalance is most likely to cause cardiac arrest? Correct answer is option C, hyperkalemia. The normal serum sodium level is. Correct answer is option A, 135 to 145. Which injection is given intradermally? Correct answer is option C, BCG. Which is the earliest sign of hypoxia? Correct answer is option B, confusion. Which condition shows a butterfly rash? Correct answer is option B, systemic lupus erythematosus. Which of the following is the drug of choice for status epilepticus? Correct answer is option B, diazepam. Which method is best to assess fluid balance? Correct answer is option B, monitoring weight. Which of the following is a live vaccine? Correct answer is option D, MMR vaccine. The drug used to treat anaphylactic shock is. Correct answer is option B, epinephrine. What is the first step in the nursing process? Correct answer is option C, assessment. Which is the most common site for IM injection in adults? Correct answer is option B, gluteus maximus. The antidote for organophosphorus poisoning is. Correct answer is option A, atropine. Which part of the brain controls body temperature? Correct answer is option C, hypothalamus. Which condition is characterized by elevated TSH and low T3 over T4 level? Correct answer is option B, myxoedema. The universal recipient blood group is. Correct answer is option B, AB positive. The common complication of prolonged immobility is. Correct answer is option B, pressure ulcer. Which of the following is used for TB diagnosis? Correct answer is option B, Which position is used during shock? Correct answer is option C, Trent-Lindbergh. Which microorganism causes whooping cough? Correct answer is option B. Which of the following is not a feature of nephrotic syndrome? Correct answer is option D, hematuria. Which vitamin deficiency causes neural tube defects? Correct answer is option C, folic acid. What is the normal range of respiratory rate in adults? Correct answer is option B, 12 to 20 breaths per minute.